We're going to do biofeedback, cranial electrical stimulation. Hi, Chuck Rogers, Windhurst Counseling Center. I want to spend a few minutes with you talking about something called cranial electrical stimulation, or CES. It's a great medication alternative that we're really excited about it. CES received clearance from the FDA in 1979 for the treatment of depression and also anxiety and insomnia. How it works is that CES is applied through the application of two small electrodes that are placed on either, actually both, of your earlobes. The CES device is really quite small. It's no bigger than a cell phone, and it's powered by a 9-volt battery, or I think the newer versions are powered by two AA batteries as well. Stimulation ranges anywhere between 100 and 500 microamps at 0.05 hertz, which means that you can barely feel the stimulation. And the device is believed to stimulate the brain stem to produce serotonin, neuroepinephrine, and acetylcholine globally across the brain, resulting in a calm state of mind. Depending on the severity of the condition, the usual protocol consists of about 5 to 6 weeks of treatment, and it begins with daily treatments for about 60 minutes, depending on the severity of the condition. And then depending on the severity of the condition, treatment can take place in our office in addition to psychotherapy, maybe even 3 to 5 days a week. You may also elect to kind of rent a device from us and use it at home as opposed to using it here in our office as well. According to research, treatment has a very calmative effect, making each treatment last longer than those preceding it. You'll usually notice a difference right away, maybe even after the first treatment, and the effects may last several hours. After you built up the treatment, say 5 to 6 weeks, improvement has been shown to really last indefinitely. Research on the device is that clinical randomized controlled research studies have shown CES to be very effective treatment that's produced results greater than medication alone. Here in our clinic, Dr. Barclay recently performed a randomized control study with the use of the CES device using the Alpha Stim device that went before the FDA. And his study was wonderful. It showed a 56% reduction in symptoms of anxiety and 53% reduction in the symptoms of depression in as little as 5 weeks compared to that of a sham group. Isn't that incredible that that amount of change can take place in 5 to 6 weeks? There are no real known serious adverse side effects with the use of the CES device. The only known non-serious effects have been mild headache, skin irritation at the site of where the electrode was applied, or some mild nausea. However, these effects are only known to occur if the current is turned up too high. No adverse side effects have been reported to be long-lasting. So we're really excited about this. On a personal note, while we had the study going on, my wife had been struggling for years with initial insomnia, meaning that it was very difficult for her to fall asleep. And it started soon after the birth of our son and had gone on for about 14 years or so, if memory serves. And so I grabbed one of the devices and took it home, and she started seeing some really great effects of being able to fall asleep faster within probably the first 1 to 2 weeks. And then at the end of 5 weeks, the symptoms of initial insomnia were just totally gone. So we're very grateful for the effects of this. I know that I am as well. So Chuck Rogers, Windhurst Counseling Center. Give us a call at 434-237-2655, and we'll get you on the road to feeling really, really good.